So you may be one of the 1 in 4 Americans diagnosed with a silent disease called fatty liver disease. Yes, this is such a common problem, and currently it is the #1 cause of liver failure or liver cirrhosis. Well, in this video today, I will discuss what exactly is fatty liver disease, what causes fatty liver disease, how do we diagnose someone with fatty liver disease, can you reverse it, can you get it if you don't drink, and at the very end of the video, I'll tell you how serious fatty liver disease can be for you. Guys, let's talk about it. Howdy y'all, Dr. Samir here, aka your poop guru. Yes, trying to give you the best tips and tricks to help out with your health. If you haven't already, don't forget to smash that like button. Like, share, and subscribe. And if you haven't already, for goodness sake, don't forget to subscribe to my weekly newsletter where you can get great tips and tricks just like in this video. So many people have been diagnosed with fatty liver disease, and more importantly, there are so many undiagnosed patients and people who may have this condition as well. What exactly is a fatty liver? Well, fat can accumulate in the liver for any number of different reasons. For some people, it's fat around the belly, plain and simple. If you have a big belly, there's a very good chance that fat's gonna go inside your liver. But sometimes alcohol can also cause fatty liver disease as well. And these are the biggest causes of why people can get fat in the liver. Now, the way we diagnose fatty liver disease, there are a couple different tests that we can use. On physical exam, it is very hard to feel the liver. Sometimes we can, but if you're overweight or have a lot of fat around the abdomen, sometimes it's hard to push on that liver on that right side. So we have to use other means to help diagnose somebody with fatty liver disease. So the most common way is to do what's called an ultrasound. This is a little machine, very similar machine that we use to see if you have a pregnancy or how long your pregnancy is. We can use the same machine, take a look around the liver, and that will allow us to see if there's fat in the liver or not. But what it doesn't allow us to see, how much fat is in there, but also more importantly, the degree of inflammation that is going on from that fat. There are a couple different ways we can see that, because that's very important for us to know what the long-term consequences are for your liver. There are some blood tests that we can check to help calculate a score to see what the degree is of how much inflammation is going on in your liver, and that will allow us to predict whether your liver is in danger or not. Then lastly, the gold standard is to do a liver biopsy, where actually we'll put a needle, small little needle, inside that liver, look at it under a microscope, and see how much inflammation is going on and what degree of scarring do you have. Now, this is a very, very, very important question, because there are plenty of patients who have fat in the liver that we can see on ultrasound, but have no clinical consequence of progressing into end-stage liver disease or cirrhosis. And there are other people who have fat in the liver which have significant inflammation and scarring or fibrosis occurring, and that scarring over time will lead to end-stage liver disease or liver failure. So that degree of fibrosis or scarring in somebody who has fat is such a critical determinant of whether that patient is going to progress onto liver failure and or not. Now, blood tests that we do can help determine that, because we can calculate a score. That score is not determined based on how much inflammation is going on. So for example, the most common blood tests that we do that you'll see are called the ALT and the AST. These are liver tests that some people look at to help determine what's going on in your liver. But if you are a liver specialist like me, you know, and I know because you're watching this video now, that those numbers alone do not tell you how much inflammation is going on. There are other markers that we do, other calculations that we need, and so this is why it's very important for us to not to assume that just because you have a certain number on a blood test, that alone determines how much scarring is going on. We need to know this, because if there's scarring, there's a very good chance that scarring is going to continue and lead to end-stage liver disease. Hey, if you're getting great value from this video, I really would appreciate it if you smash that like button and comment it down below. So can you actually reverse fatty liver disease? Well, the answer, thank goodness, is yes, you can. Yes, you can. Yes, you can. Yes, you can. I'll put a link up here on how I recommend for you to treat and reverse fatty liver disease. Your liver is such a fascinating organ. It is one of the very few organs that can regenerate on its own. It can go back to normal no matter how much damage that you cause. So if you've drank for years and you don't have cirrhosis, you can reverse it back to normal. Or if you have a lot of fat around the belly, you can lose weight and make your liver go back to normal. But what's very important though is for us to calculate that score. That score will allow us to determine how much damage is going on and what degree of inflammation is occurring inside your liver. But I will tell you, by and large, if you don't have liver cirrhosis or end-stage liver disease, the answer is hell yeah, heck yeah. You can reverse your liver and get it back to normal again. Now, another common question that I get is, can you get liver disease even if you don't drink? Absolutely you can. Like I mentioned before, the number one reason for liver failure in the United States, and this is why fatty liver disease is such an important topic, is fat accumulating in the liver. And the most common reason for that is just having a big belly, having obesity, having insulin resistance, diabetes, heart failure, all the risk factors that can lead you to have all these complications from too much fat in the belly. And absolutely, I've had so many patients tell me that, hey, Dr. Islam, I do not understand why I have cirrhosis or why my liver is failing. I don't drink. And I have to tell them, alcohol is not the only reason why you can have liver cirrhosis. I know when people hear cirrhosis, they automatically think of a drinker. That's not the case anymore. Fatty liver disease is one of the more common reasons why people get liver failure. And this is such a deadly problem because fatty liver disease does not cause symptoms. You may not feel anything, you may be doing fine, then all of a sudden you end up in liver failure, which is why it's important to be proactive about your health and your liver. And if you don't become proactive, you will end up with liver failure. And if you ever met anyone who has cirrhosis, it is such a difficult disease to manage. You get confused, you don't know where you're at. You can end up vomiting blood and passing away from that. You develop ascites, which is fluid around the belly. It is almost like liters and liters of fluid around your belly. You can't breathe, you can't sleep. It's uncomfortable. You just feel really, really bad. And that fluid can go down to your legs and get edema as well. And all that, plus you also have a significant chance of developing liver cancer. It is not a problem I want you to have, and I want you today to know what's going on so you can prevent that issue from occurring. So my question of the day for you, what questions do you have about fatty liver disease? Comment down below. I would love to hear what you guys have to say about it. Thank you for watching. Don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to a weekly newsletter where you can get great tips and tricks just like you learned in this video. Guys, and thank you for watching. Hope you have a happy and healthy day. Take care, everyone. Thanks. And if you want to learn more about fatty liver disease, don't forget to subscribe and also click this link right here on what you can do and my recommendations for fatty liver disease.